Let's talk about vaccination rollouts, and the Ghana Health Service has begun administering the second doses of the AstraZeneca vaccines, targeting the nearly 350,000 persons who took their first jabs in March. The inoculations are expected to take place mainly in all 16 regions of the country where the first jabs were administered. In the Ashanti region, health officials say the exercise will begin on Wednesday, September the 1st, with more than 70,000 doses allocated to the region. There is more in this report.
Earth Rights and the Ghana Tourism Authority hosted the conference on tourism, COVID, and the environment on Wednesday.
But what's the vaccination rollout plan, especially in the regions? Here is the program's manager in charge of the expanded program on immunization, Dr. Kwame Amponsa Achiano, with details.
We've done approximately 850,000 persons, of whom a little over half have already received their second dose around somewhere in May. So we now have taken delivery of approximately 250,000 doses of AstraZeneca, and we want to continue with the second doses for those who have been waiting. So we have approximately 400,000 plus persons waiting for the second dose. So the plan is, once you get a vaccine and you look at the population, you definitely have to do a kind of equitable distribution, because the vaccines will not be enough to cover everybody at the same time. So what we've done is we've done some kind of sharing for all regions to benefit based on the data that we have. And so we've distributed our vaccines to all the 16 regions for those who have been waiting for the second dose. So that's the plan, and we're starting this week, today. First of all, you look at those that are most vulnerable, and in our case, is the health workers. And of course, if you recall, when we first started, we also spoke of the elderly and the people with underlying conditions. So they were first taken care of when we started the vaccination exercise. And for every region, you had some number of persons within this category. So we share the vaccines first to cover some proportions of health workers and also some proportions of the general population with respect to those who are most vulnerable. And they were the ones who received the vaccines earlier on. You would also recall that when we started the second dose in May, we targeted persons who had received the vaccines from the 1st of March to the 9th of March. So it stands to reason that we just have to continue from the 10th of March. And looking at the data, when we end on the 29th, we would have dished out all the vaccines. And therefore, there will still be some almost 200,000 people who would have to get the second shot once we get vaccines next week, maximum within the next 2 weeks. We still have some vaccines in the pipeline, AstraZeneca vaccines, and even other vaccines like Moderna, Pfizer, and Johnson & Johnson. But for the purpose of this discussion, I would say that we are expecting 350,000 doses of AstraZeneca to be delivered to us within this week or next week, and then we can restart the second dose and complete it by the middle of September.
Well, the regional health director in Bono East says their work is cut out for them in terms of having data on the hotspots in the region.
If you look at our figures, you remember when we had a discussion, the 31st week, we use weeks. We recorded 220 new cases. Then the 32nd week, we recorded 200 new cases. And then the 33rd week, we recorded 135 cases, new cases. And then just the past week, we recorded 145 new cases. And for me, if you ask me, I think the measures that we have put in place are actually yielding results. And if we continue as we have been doing, definitely, I think the numbers are going to come down. So far, I appreciate where we are now, and I believe that we can still do more. We have been able to prioritize who should get it and where. You remember the last discussion that we had. If you look at the figures for Bono East, about 80% of all our cases are driven by only 4 districts. You know, Bono East, we are having 11 districts. But if you look at the epidemiology of what is happening, about 80% of all these cases are coming from only 4 districts. So the idea is if you're able to tackle these districts, obviously you're able to bring down the spread. And then more importantly, even if you look at the districts where all these cases are coming from, for example, if you take Techima Municipal or Techima South, where almost we have a larger chunk of the cases coming from, they have 7 sub-districts making the Techima South. But if you look, 90% of all these cases is coming from only 1 sub-district. Okay. That is the Techima Central itself. So we believe that straight away, our job is well cut for us. We know where we have to spend our money. So we prioritize and make sure that, at least for what we have in mind, that we are going to ensure that we enforce the adherence to protocols. The security agencies, for that matter, are a priority because they are going to enforce that. And then if you also look at Nkranza South, it's also about 6 sub-districts. And thankfully, the driver is only in one of the sub-municipal, which is driving more than 80% of the new cases. So you see that our cases are well localized and lobulated, so that if you're able to channel all our energies in these sub-municipal.
Well, in other news, the Environmental Protection Agency is asking patrons of hotel services to go along with their own bath towels. The agency believes this will be one sure way of reducing the risk of contracting the fast-spreading COVID-19 virus, which has so far killed more than 1,000 people in Ghana and many more around the world. Director of Human Settlement Unit at the EPA, Cindy Bedu, was speaking at a conference on tourism, COVID, and environment.
Earth Rights and the Ghana Tourism Authority hosted the conference on tourism, COVID, and the environment on Wednesday at the Accra Tourist Information Center.
Earth Rights invited you because we believe that tourism is sitting on a three-legged stool now, namely environment and COVID. One of the legs is on the threat, the other leg is a threat. And quality concerned minds are needed to remove these threats.
The conference aimed to point out how to improve Ghana's tourism industry, especially with regard to the realities of the pandemic and the losses it has cost the tourism sector.
Tourism is the face of service, and tourism is the thing to help all of us.
The conference highlighted issues with training in the hospitality industry and discussed how to improve Ghanaian service standards in order to attract more tourists.
The person should incentivize that service, and that's what we're looking at the person. You know, don't take somebody who doesn't like to smile at the reception. The person must be bothered. Hello, can I help you? You know, that's what we are looking at. So,
but the lack of hospitality training isn't the only issue in the tourist industry today.
The disruptive and devastating effects of COVID-19 pandemic, especially in the tourism and hospitality industry, is well known and highly visible with its socio-economic and developmental effects.
Obviously, you have to go through all these travel advisory processes and then restrictions vis-a-vis COVID tests on arrival, quarantines. Fortunately, in Ghana, even though we have a very rigorous system in place, way of screening tourist arrivals, we still have to go through certain protocols. So that in itself also restricts tourist arrival. The Delta variant, one can't be so sure, and that's where, you know, somehow the citizens lose guard and then things go a bit off the mark.
Mr. Kwesi Eyason, also added that the Ghana Tourism Federation was having challenges to ensure that tourists adhered to COVID protocols, but they would soon lay out strategies that would ensure Ghana maintains its position as the top country when it comes to COVID management. This is Natalie Miking reporting for JoyNews.